good morning.
Good morning, Dr. Blackman.
So you've had pain in your right shoulder and pain in your thumbs for quite some time.
Yes.
How disabling has the shoulder pain been? How disabling has the thumb pain been?
Disabling enough to restrict some of the activities I have to do in the office, especially working on cervicals. Asymmetry noticed in the gym. The pain at night would be so bad that it would wake me up, like when I was turning over or trying to get comfortable, pulling the sheets up. And over the past year, I've tried nothing but anti-inflammatories and some immobilization braces, but without any really positive results.
And you've had trouble even getting dressed.
Yes, could not tuck my shirt in, could not do this.
Mm-hmm.
So now, as you can see, I can do that.
You can do that easily enough. So the shoulder never had a diagnosis.
Correct.
But the thumbs did.
Yes.
What was that?
Advanced degeneration in both, more so in the right than the left.
Of the thumb joints?
Yes, all in here.
And so we started with some food changes, some glucosamine cream.
Correct.
For the joints, because we need to grow some cartilage in them. And then we started with trigger point injections, and that really, the response to that, how much pain did that take away?
First injection, I got about a week's worth of relief. The second one, about 3 days, and then everything kind of came back.
And the relief was pretty complete.
Yes.
As I recall.
Yes.
So the interpretation of that is that the trigger points reform and the muscles rekink because they don't anchor well. And so 2 weeks ago, we did a needle surgery with PRP.
Correct.
And you've had some improvement since then.
Vast improvement. Left hand, thumb, right, and the shoulder itself have been fantastic. Just some residual stuff with my fine motor skills with writing, holding the pen and cramping up, stuff like that.
And the shoulder, how much has that improved?
100%.
Yeah, no pain at all.
Nope.
We're just not back in the gym yet.
Nope. I'm being diligent with my recommendations from my doctor.
So you can probably give it a little bit of a tweak this week.
I'll try it.
And we just did some trigger point injections for the residual pain in the right thumb. Let's see if your dexterity is coming back.
So one of the difficult things I had was drawing a circle when I do my initials on some of my paperwork, and no difficulty whatsoever after the trigger point injection.
That's awesome.
Thank you.
All right.
I got more paperwork to do.
You have a wonderful day.
Thank you.
You're welcome.